or rectal bleeding is common problem in the adult and children. So by far the commonest is the bacillus dysentery, shigellosis, and other invasive dysentery like Campylobacter, non-typhoid salmonella, your enterovasculitica, and Campylobacter jejuni, and so many. So the blood in stool is little with high frequency is diagnostic of the bacillus dysentery is the which is almost synonymous with the Shigella dysentery type 1 in this country. Amoebic dysentery is not that uncommon over here, but frequency of amoebic dysentery is a little bit less than the bacillus dysentery, and blood is more prominent in the amoebic bacillus dysentery with little amount of stool. If high frequency, you do not have much stool. Where amoebic dysentery have plenty of stools and little amount of blood, maybe little amount of mucus. Hemorrhoids or piles with anal fissure, they are important cause of bleeding. Here, bleeding is fresh blood, hematochezia. And if you do the DRV or the rectal examination, proctoscopy, now you will get the answer. Ulcerative colitis and Crohn's disease, the inflammatory bowel disease, they have intermittent sort of the blood in stool, and then the dysentery presentation, abdominal pain, tenesmus, and then you have growth failure. So their diagnosis is by biopsy, and then your melena, the black tarry stool, is usually due to the upper gut bleeding like peptic ulcer and others. So the here occult blood test is positive, and this is the peroxidase reaction. Hemoglobin is converted into in the your kind of ingredient which turns black. Mind it, the banana, your broccoli, radish, they also give false positive results. You need more than 20 ml of blood to have the occult blood positivity, and lesser amount of blood, intermittent sort of bleeding may not give the OBT positivity. So when someone turned pale, this sort of internal bleeding, do not always expect that OBT will be positive. At times it is negative. Clinical evaluation is important. Hemoglobin and clinical pallor, this is important, and identifying the cause as per clinical suspicion is important.